Surgery for heartburn, reflux, and GERD. Surgery for heartburn and reflux, also known as anti-reflux surgery, is an important treatment option for patients. To understand how this surgery works, let's take a look at how food is digested and how acid reflux happens. Heartburn and reflux is also known as gastroesophageal reflux disease, or GERD for short. The human esophagus or food pipe starts at the back of the throat, travels through the chest, and then across the diaphragm into the abdomen where it connects with the stomach. The connection between the esophagus and the stomach is made of a thick muscular valve known as the lower esophageal sphincter, LES. After food and liquid passes through the mouth and into the throat, it then enters the esophagus. The human food pipe travels down the esophagus, and then across the diaphragm and into the stomach. The LES normally stays closed, much like a gate. When food enters the esophagus, the LES will relax and open to allow the food to travel into the stomach. When food enters the stomach, it is quickly greeted by stomach acid, which helps break down the food. Stomach acid is strong enough to corrode and weaken certain metals. However, your stomach lining is protected from this harsh acid by a defensive barrier. The esophagus, on the other hand, can be injured, or burned, by this strong stomach acid. However, the LES is designed to protect the esophagus by preventing the stomach acid from going back up, reflux, by staying closed until food comes down. When the LES becomes too weak to close properly, stomach acid can reflux back up the esophagus easily. This is how GERD occurs. Over time, with repeated exposure, this harsh acid can injure and burn the esophagus, causing reflux esophagitis. The burning acid caused the symptoms of heartburn, regurgitation of undigested food, chest pain, nausea, and vomiting, which are typical of GERD. The LES can be weakened by a number of conditions and foods. These include chocolate, peppermint, pregnancy, obesity, smoking, and eto abuse. These factors can weaken the LES and make the GERD worse. Sometimes, people can have a hole in the diaphragm through which the stomach escapes the abdomen and enters the chest. This is called a hiatal hernia. A hiatal hernia creates a large opening where the LES should be, causing stomach acid to reflux up and resulting in GERD. Symptoms of acid reflux can include heartburn, chest pain, difficulty swallowing, and even a sore throat. One way to treat acid reflux is through medication, such as antacids, H2 blockers, or proton pump inhibitors, PPIs. These medications work by reducing the amount of acid produced in the stomach. However, for some people, medication alone may not be enough. In these cases, anti-reflux surgery may be an option. The most common type of surgery is called a laparoscopic fundoplication. Laparoscopic fundoplication is a surgical procedure that is used to treat conditions such as acid reflux and hiatal hernia. The procedure is done using a laparoscope, which is a thin tube with a tiny camera on the end. The surgeon makes several small incisions in the abdomen and then inserts the laparoscope and other instruments through these incisions. The goal of the surgery is to create a new valve at the top of the stomach that will prevent stomach acid from flowing back into the esophagus. To do this, the surgeon wraps the top portion of the stomach around the lower end of the esophagus with stitches. This creates a new, tighter valve that will keep stomach acid from flowing back up into the esophagus. The procedure is performed under general anesthesia, completely asleep, and usually takes about 2 hours. Recovery time varies from person to person, but most people can return to their normal activities within a few weeks. The benefits of laparoscopic fundoplication include less pain and scarring than traditional open surgery, and a quicker recovery time. Most people experience significant improvement in their symptoms following surgery. The benefits of fundoplication include 1. Relief of symptoms of GERD such as heartburn and chest pain, 2. Healing of the esophagus from damage that has been done by acid reflux, and 3. Reduced risk of complications such as Barrett's dysplasia, a precancerous state related to long-term acid reflux. As with any surgery, there are potential complications. General surgical complications include bleeding, infection, and reactions to anesthesia. More specific to fundoplication, potential problems after surgery include difficulty swallowing, difficulty belching, and bloating. In addition, surgery may not fully correct the problem and further treatment with medication may be required. A full discussion with the surgeon performing the procedure about the risks of, benefits of, and alternatives to surgery should occur during your visit. If you have heartburn and acid reflux that is not controlled by medications, or you want to simply get off of your medications, consider a referral to a surgeon that specializes in this type of surgery.